Thank you so much, Kumkum. Thank you for having me. And thank you, each and every one of you who are here tonight. I appreciate your time. I'm very cognizant of how busy each one of us is. So, my goal for tonight is to give you an incredible amount of value in a very short time. My hope is that I can teach you something tonight, guide you through something that you can take home with you, that you can implement in your life, in your health, that will make a significant difference in the impact of your health on the long run. And just judging by the amount of people that registered, we were full and we had to open up more seats to accommodate more people. That shows us how important this topic is. And I'm glad that this topic is so important to all of you. It's very important to me. I'm very passionate about this. And I'm going to tell you why. But before we start, I want to, as Kumkum said, thanks so much. I want to cover all these topics that you mentioned. My hope for tonight is that you will take something practical that you can implement in your own life. I want you to imagine your life like a big boat. And imagine you are here at Burlington at the pier, and you have your boat, and it doesn't have to be a fancy boat, maybe a tiny little motorboat. Your friend is at the engine, ready to open the gas, and you're at the steering wheel. If you make a small little change to the left, in 2 hours, you're going to end up in Toronto. If you make a small little change to the right, you're going to end up in Hamilton. And the same is true in our health. We can implement very small changes today that in the long run can have a significant impact on our health. It can impact our risk for cancer. It can impact our risk for dementia, for heart disease. It is so profound, and I'm so passionate, and I really hope you gain something that will help you to be healthier, to be stronger, and I want to guide you through it. So, when I grew up, where everything started, when I grew up, one of my dad's best friends got diagnosed with colon cancer, and he eventually passed away from colon cancer. He was very young. He had 4 little kids, the age I was one of 4 kids. Our kids, they were the same age as us. One of my dad's very good friends. My dad and my mom, and also him being academics, the gentleman worked with my dad at the university. They were very passionate about, first of all, they had access to a lot of research, which a lot of people didn't have in the 80s. We didn't have the internet. We couldn't just research. So they researched everything about colon cancer. And they were so surprised to find what a big impact your diet has on colon cancer. So from a young age, my mom implemented all these things that they learned. My mom would go to a market not close by, but a farmer's market where she could buy produce directly from farmers, free from pesticides, not genetically manipulated. She would make sure that we don't cook our food in the microwave, but for veggies, rather steam it, do things to preserve all the nutrients. Then, as when I went to university in South Africa in med school, fascinating, we had a big number of people with HIV/AIDS. But very interestingly, if a mom has HIV, it doesn't necessarily mean that her baby is going to have HIV. If the baby is born without coming in contact with the mom's blood, so if you don't need to cut for episiotomy when you deliver, and the baby is nicely protected in the uterus, in that umbilical, in the sac. If the baby nicely comes out, not in contact with mom's blood, and you test the baby can be born without HIV. But then when the baby drink milk from the mom, the baby can be exposed to HIV and get the virus through the gut. Then we found with fascinating research that if that baby doesn't get any other food, not any formula milk, only mother's milk, the baby's gut will stay intact to such a degree that the virus, even though there's virus in the milk, the virus doesn't pass through the gut into the baby's bloodstream. So what we did in South Africa when I studied medicine 2001, 2002, 2003, 2005, and 2006 was to recommend to mothers to exclusively breastfeed the baby, even if they are HIV positive, until 6 months. And that's typically the age when a baby would want to explore with food. Then to stop breastfeeding, if one feed would be your last breastfeeding feed, and then to introduce foods. So when the mom introduces foods, the baby will develop a bit of a leaky gut. So that would be impurities into the gut lining, just a leaking into the gut lining where environmental toxins can be introduced into the gut. And not just toxins, but also virus from the milk. And it's fascinating the research that was done, how kids could have a healthy, intact gut on mother's milk, and then as soon as foods get introduced, develop leaky gut. So that has always fascinated me quite a bit. You know, our gut is quite big. If you look at your gut all the way from your mouth, through your esophagus, your stomach, your duodenum, jejunum, your small bowel, your colon, if you have to stretch that out, you know, that would cover quite a few football fields, the epithelial lining. So that is a big way how your body is exposed to your outside world is through your gut. So a lot of toxins that we introduce into our bloodstream is actually through our gut. However, fascinating, some people would have a more whole gut, a more healthy, intact gut, where we look under a microscope. The integrity of the gut is healthy and strong. Those people won't, if they eat something that's bad, maybe get exposed to plastics. You know, there are so many toxins in our environment. I have a whole workbook on that on our website if you are interested in it. But if you are exposed to plastics, to things in your food, drink, pesticides, and you have a very healthy gut, your gut has this ability to protect you and not to absorb as many from that harmful toxic substances into your bloodstream. However, if you have a leaky gut, then your body will absorb way more into your bloodstream. And then I work here at the Oakville Hospital. And when we do a colonoscopy for a patient, we can clearly see some people would be quite at the spectrum where they have severe inflammatory bowel disease, or maybe especially after chemotherapy, people will have more inflammation if they have an autoimmune disease, Crohn's disease, ulcerative colitis. You know, these people would have significant inflammation. But we have a whole spectrum. And I've always found people will come to me and say, I have significant gut symptoms. I've had a colonoscopy. My colonoscopy is normal, but I have symptoms. Now, what now? And that is a very big part of what I do here at my wellness clinic at the hospital, is to see people who are not at the spectrum where they have cancer or inflammatory bowel disease. So they're not at this end where they have to go onto autoimmune medication, biologics, but they're somewhere in the spectrum where they have significant gut symptoms. So before I give you the solution for gut symptoms, I will want to tell you something else very interesting. Is when I started my family practice, I came to Canada in 2010. I had a big family practice. When I started my family practice, if someone had chronic pain from rheumatoid arthritis or autoimmune disease, we would often refer them to a pain clinic. That pain clinic worked miracles. I couldn't believe it. People who would need prednisone, steroids, opioids, morphine, biological medication to manage their pain. At that clinic, they would recommend the patients to stop gluten in their diet. And then within 3 to 6 months, the patients would become pain-free. And then within 9 months, they'll be off all their medication. I honestly couldn't believe it. So that kind of opened a whole new world to me, like, what? How can that be possible that people could, with diet alone, change severe disabling pain symptoms? You know, that's just incredible. Then, as I was trying to educate myself on all of this, So things that I didn't maybe learn in medical school, and I teach here medical school at McMaster University, but we have such a big breadth and big amount of volume that we teach medical students, that we teach our residents specific fascination regarding nutrition, the gut. That is often things that we don't delve into as deep in medical school. So I really wanted to educate myself. I did more training at Harvard Medical School, Switzerland, the Institute of Functional Medicine, and I became double board certified through the American Board of Lifestyle Medicine to learn all the research and the most fascinating research where they would look at the bacteria in people's gut. So the bacteria in your gut, we call your microbiome. And what microbiome means is that in your gut all the time, there is millions and millions of different bacteria, viruses, protozoa, and they all live in balance with each other. Sometimes we throw the balance off if we use antibiotics. We kill off bad bacteria, but unfortunately, we kill off good bacteria as well. Then there are things we can do to, after we had to be on antibiotics, things we can do to improve the diversity of our gut. And those would be things, this is the first thing I'm giving you today to take home that you can try at home. We can put back good bacteria into our gut and increase the diversity. It means all the different ones. You don't want just one or two types. You want thousands of millions of different types of bacteria in your gut. A way you can do that is by eating probiotics. So probiotics would be what you have in yogurt, and what I generally recommend to my patients better than yogurt would be kefir. Kefir is a yogurt drink that you can get on dairy alternatives like plant milk, almond milk, with lots and lots and lots of bacteria. So there are a lot of foods that are very rich in probiotics, and then even more important, fermented foods are prebiotics. These are foods that the probiotics in your gut feed on. So first we got prebiotics, then probiotics. Prebiotics are fermented foods such as sauerkraut, kimchi, tofu, miso, foods that feed anything that's pickled that maybe got old, and things like garlic, onion are good prebiotic foods that feed the organisms in our gut. Okay, so why this is so important? They've done research where they would test people's stool, their poop, they would test it, and they would look at people who are very depressed, and then look at a group of people who are very happy. And the people who are very happy would have a way more diverse microbiome. Then they would do an actual stool transplant where they would take some stool of people who are very happy and they'll put it in the gut of people who are very depressed. And then you won't believe it, but the depressed people then became happy. It is absolutely mind blowing, incredible research that your mood gets affected by the amount of bacteria in your gut. So then they've done one study after the other study, and good news is you don't need a poop transplant. You do not need a fecal transplant, but you can eat certain foods to increase the diversity of your microbiome. So that's just absolutely mind-blowing if you think about that your happiness and your mood can so be impacted by what you eat. 90% of your serotonin is made in your gut. So I want to pause here. That's big. Your serotonin is your feel happy hormone. The amount of serotonin in your body will help predict how happy or how sad you are. And you, you know, a lot of people, especially when I see people here in the hospital in our mental health unit, quite often people, when they are very depressed, they don't realize that there are actually things that they can do to get themselves better. And that's what I really learned a lot about in lifestyle medicine. There's a lot of things. Manage your stress, avoid toxins, um, do more exercises. So many things you can do to significantly improve your mental health. But then fascinatingly, the way you eat, eating whole foods, predominantly plant-based, but whole foods, can increase your happiness. So serotonin is when we give someone an antidepressant, what we essentially give is a selective serotonin reuptake inhibitor. So what that means is that you have this happy hormone in your body that your body secretes, but your body breaks it down all the time. Then what the medication does, an antidepressant, if your doctor prescribe an antidepressant, is it slows down the breakdown of your natural happy hormone in your brain. It doesn't make more happy hormone, it just slows down the breakdown so that you have it there available longer. But if you think about it, if you can improve the amount of happy hormone that your body make with what you eat, that is such an incredible way that you can increase your happiness. So mood is a very, very, very big thing that you can do to increase your happiness. Next thing, which is a big thing that you can do to increase your happiness, is, well, I'm not even going to delve into it. I'm very passionate about your happiness, things that you can do for your happiness. I'm not going to delve into it, but just so that you know that you can exercise, sleeping better, meditation, really looking at who you surround yourself with, avoiding toxins, all these things are things that you can do to improve your happiness. But then diet is a big thing. So something, other research that they've done specifically on gut health that is incredible interesting is that they found that people who are overweight have different bacteria and different genetic material in their gut than people who are at a healthy weight. So this is mind-blowing. I'm not going to go too deep into it. I work at the Wellness MD clinic here. That's where I'm sitting now. Is at in my clinic, Wellness MD clinic in Oakville. I have a doctor who works with me on our team at Wellness MD who specializes in obesity medicine, Dr. Ashley White. When she worked with someone, she would do gut testing, where they actually test your stool, the genetic material of the microbes in your gut. And then once she know what your gut health look like, she helped people lose weight. My mouth hangs open to see the incredible success she has with people who's taken years and years and years and couldn't lose their weight. And now they're able to lose weight just by tasting what the bacteria in their gut look like. That is mind blowing to realize that if you've struggled for years, yo-yo dieting, not able to lose weight, you might want to consider looking at your gut health, looking at the bacteria in your gut. That's a whole topic on its own. And maybe Kumkum, maybe you must invite Dr. White for another talk specifically because that's at least a few hours on its own, but how bacteria can impact and your gut health can impact whether you struggle with your weight or not. Okay, so to move on to the next one. So when COVID struck, patients started coming to me because I'm known as a wellness expert, and they would come to me and say they want to go off their autoimmune medication, their biologics. Maybe they'll be on biologics for multiple sclerosis, rheumatoid arthritis, any autoimmune disease, as biologic medication, suppress your immune system. So what an autoimmune disease is it is your body attacking itself. So the medication we then give to treat that autoimmune disease would be a medication that stop your own immune system, lowers your own immune system. So it helps your immune system not to attack yourself. It's very successful. The medication is fantastic. But then it also lowers your immune system in such a degree that you might not be able to, that you're more vulnerable to viruses such as COVID. So I've had these people come to me say they want to go off their autoimmune medication and they want me to help them with diet. And I was like, whoa, I don't know about this. This was in 2020. So I read up quite extensively about the role diet plays on autoimmune diseases, and it's absolutely fascinating. if you want a quick overview, you can have a look on the website of Dr. Terry Wahls, WAHLS, terrywahls.com. She's done a lot of research. Doctor with multiple sclerosis, which was quite disabling. She was in a wheelchair. And then this was 20 years ago. And then she was a vegetarian at the time. She realized the importance of food for her specifically. She had to introduce animal protein into her diet, even things that we don't typically eat anymore. Bone broth that you can make from animals, where you get collagen in from animals, and that collagen helps to heal your gut. Once your gut is healed, you're less exposed to toxins from the environment. Your gut absorbs less toxins. Fascinating research she's done. So I read up on it. The research made sense to me, and I agreed to take on my first client to treat autoimmune disease with diet alone in 2020. So I didn't tell him to stop his autoimmune medication, to be very clear. He stopped it on his own. He came to me for help after. And I still do. When people work with me, I don't tell them to stop their cancer treatment or stop their autoimmune treatment or to stop their diabetes medication. No, I first help them implement these lifestyle changes. And then once their psoriasis has cleared, once their arthritis pain is gone, then we say, okay, let's see what happens if you cut back on your medication. Or once their diabetes markers are normal, then we say, let's see what happens if you cut back on your insulin, does your sugar stay stable? So I'm not an advocate of stopping medication. I'm a fully trained Western medicine doctor. I work in the Oakville Hospital. I'm pro-medicine, but then I'm also pro nutrition to help your body to heal. Your body has this incredible capacity to heal itself, but we hinder our body with our diets, which will get me a little bit deeper into diet. But in essence, what this diet looks like, the diet that helps people heal from autoimmune diseases, contains a very high amount of antioxidants, phytonutrients. To get all that antioxidants and phytonutrients in your body to help your body to heal naturally from the inside, you need to eat vegetables. And something that you can do if you want one take home today is to start tracking your food. Take a week, use an app and track everything you eat. Quite often people think they eat healthier than what they actually do. So something you can do is to just at home start tracking what you eat, to become self-aware of what your diet looks like. That's quite a big thing. If you and to really have that understanding, and I know all of you watching today are at different phases in your life. Some of you might think all calories are equal. If you had an ice cream, you'll save calories and not have dinner. If that's where you are at, tonight I want to say that no, all calories are not equal. If you've had the ice cream, please still have dinner and make sure for dinner that you have some healthy proteins and that you have veggies to increase that diversity in your microbiome. So that's quite important. Then a lot of my other clients would think that if things doesn't have calories, maybe you've been to Weight Watchers, which is a great company to help you lose weight. I'm pro Weight Watchers. But they might have taught you that some foods count zero because it's not going to make you fat. So maybe lettuce and celery and cauliflower count zero, so you can have as much of that as you want because it's not going to make you fat. So that is fantastic. But then I've seen with some of my clients, they think because it counts as zero, they don't have to eat that. And that is really, if that is you, that is a message that I would really want to bring across tonight. That just because food doesn't make you fat and doesn't have calories, it doesn't mean that this food is unnecessary. We need all the different types of food, and the more variety you can have, the better for your microbiome. And food is created in such an incredible way that if you eat broccoli, the amount of magnesium, the amount of vitamin C, the different types of food that's in there together is maximum in a way to complement each other to increase absorption. People often tell me, I don't like veggies, can't I just take a supplement? Give me a supplement, give me athletic greens. I'll just take the supplement in the morning, then I don't need to eat any veggies. Some people do need extra supplements because they have a leaky gut and they're not absorbing as many nutrients from their food. Grant that. A lot of people really need supplements. I do blood work for everyone that I admit to the hospital. And especially our older population would go on a bit of a tea and a toast diet. So I find a lot of my patients are low in calcium, low in magnesium, low in zinc. And then fascinating, even if you eat a very good diet, unfortunately our soil is quite depleted of nutrients. That's sad. So even if you have an organic diet, you grow your own foods, which is great, free from pesticides. Pesticides are one of the things that's going to harm your gut. So it is good. But it could be that you still lack some nutrients. So sometimes people need supplements, but in natural foods, foods are always in such a combination that the different micronutrients, the different elements in that food complement each other in such a way that they enhance absorption. So that's quite important. Try to eat whole foods. With whole foods, I mean food the way that you see it on a farm. If you are on a farm, you won't see like craft dinner, or um, you won't see maybe pasta, but you will see sweet potatoes. So all the foods that are foods the way they came from a farm before they went to a factory, those are whole foods. So I really would want to encourage you that all foods are not created equal. It's not, oh, you can either eat a sweet potato or you can have some pasta. The nutrient level is not the same. The impact on your health, the way it can protect you against cancer, against disease, improve your heart health, prevent dementia, all those things, you're better protected by eating whole foods. So really focus on whole foods and try to focus on plant-based foods. That means that if you have that choice between pasta or bread and sweet potato and you count out same calories, same carbs, rather take the sweet potato. Okay, quite passionate about it. It can make a significant difference in your life. If you are interested in doing that Wells protocol, I recommend that you find someone trained in it, a health coach, because it's a very hard diet to follow. You need to eat 12 servings of veggies a day to get the right amount of antioxidants. And I know a lot of you follow me on Instagram. Quite often on Instagram, I would show ways that I increase my veggie intake. It's hard. I get you. I don't have time for food prep all the time. I'm a full-time working mom. I have little kids. I'm an athlete. I didn't have time to eat all the time. So a way that I often increase my veggie intake is by making a smoothie with organic baby spinach leaves or kale. If you blend that in a smoothie, you can get quite a whack load of baby spinach condensed into a smoothie. That's what I had today for breakfast. And I got up 5 o'clock this morning. I had some work to do, spin workout. So I had a very early breakfast. So I had like a second breakfast when I got to work. And it was the same thing. I just made myself a very big jug with some protein powder, lots of blueberries, because that's maximum antioxidants, phytonutrients with minimum sugar, and a whole, what was it, 500 grams of spinach leaves. So then I know that I got quite a lot of veggies in today. That's quite nice to know that it's like 10 o'clock and you've gotten so many portions of veggies in. It feels good. Okay. Yeah, so follow on Instagram if you want to see what I do. And I also often share what I do with my kids. So I'm going to spend some time on kids because that is often something that I get questions about. Very often, I get questions about children. I have 3 children. Before I had kids, I had quite a lot of ideas as to what I would do if I have kids one day. I thought that my kids will only have organic foods, they'll never have cereal, they'll never have baby foods, I'll make everything nicely with a NutriBullet. I had very ambitious, naive, optimistic ideas. Then my first child had a sensation difficulty where he was only on formula for the first 2 years. If I knew it, I would have breastfed longer. My second and third kid, I breastfed until they were 2.5. But then for the first kid, I had no idea. I was working full time. After 4 weeks, I went back to work, was pumping at work. So I thought 6 months was good. My kid was, I thought, was ready for solids. Turned out he had a sensation issue. He refused to eat all my beautiful fresh veggies. That humbled me. That really humbled me significantly. And I have empathy with you if you have a kid who's a picky eater. There is a lot of research showing that about 50% of children in Canada are malnourished. This is significant, considering that what you feed your child impact their brain health, their IQ, their ability to compete in sports. It affects their mood, whether they're going to be cranky, colicky, irritable, whether your kid will have anxiety, all these things. The nutrition has such a big impact on it, and about 50% of our kids are malnourished. And I'm not talking about a country, third world country somewhere, I'm talking about here in Canada. So it's quite important that if your kid is a picky eater and your doctor says, oh, that's okay, they'll outgrow it, to make sure you talk to someone. I can refer you to a lifestyle medicine or a functional medicine doctor, nutritionist. Email our clinic. Our clinic is, email is info@wellnessmdhealth.com. Gerda, if you'll just put the address down for people to see. Email us if you have a problem. Just unfortunately, because we're so fully booked and we have such a long wait list to see me and our team, we at this point, I'm not seeing kids. I'm passionate about kids. Okay, but I'm going to give you a few things that you can do with kids. So, well, what we did with my son, who didn't want any sensation, is I went to a speech language pathologist and we had to desensitize him. And that's really the message I want to get across. Don't give up. Keep pushing. What we had to do for him is first just let him touch fresh fruit, touch veggies, get used to the sensation. Then as he got used to touching, he didn't have to eat it. He just had to help me with food prep. He just had to help me wash the veggies. He just had to help me cut it. Then we got to the second point where he just had to kiss it. He didn't have to put it in his mouth. He didn't have to, he just had to put an apple to his lips. He had to sniff it. He had to just touch it to his lips. And then at a later point, to just put that food inside the mouth. And he can then spit it out. He doesn't have to chew and swallow. But then desensitization, step by step, and it's so worth it. It's so important. Get someone who can go through this journey with you. It is so critical for your kid. Next thing, which my mom taught me, which I've done with all three of my kids, and even tonight, before this talk, I went home. We typically try to have dinner around 5. My kids come home famished from school. So what I did tonight with my youngest daughter, and what I did with all of my kids when they were toddlers, something my mom taught me, is while you food prep in the kitchen, to have fresh cut up veggies. Anything, cucumber, sweet peppers, tomatoes, any veggies, freshly cut up. And then while you're cooking, kids often come in and they would be, oh, mom, I'm starving. And they can start nibbling on those foods, carrots, while you're cooking. So I've always done it with my kids. I still do it. Tonight again, I saw how successful that is. So my youngest girl came in. She just nibbled. I didn't tell her, oh, eat your veggies first before you can have a cookie. Not at all. It's not a conversation. So you would want to put that bowl with freshly cut veggies on the floor, somewhere where your toddler can get to it, eat it themselves. Obviously, say veggies. You know what to say for your kid that they won't aspirate on, won't choke on. So tonight, my youngest, by the time we had dinner, I knew she ate a significant amount of peppers, of cucumber, of carrots. So by the time we had dinner and we sat down with my husband, the whole family sat down, I didn't fuss. Oh, eat your veggies. You have to eat your veggies. I had to make sure the older to ate their veggies because they didn't snack before. But then for the youngest, I knew she did get in all her veggies. So that is a tip that you can try at home. Try to always have freshly cut veggies on your table, in the fridge rather than chips. You as a parent or a caregiver or the person who shops, you have quite a lot of control on the amount on the type of food that comes into your house. A lot of parents come to me and they say, oh, my kids only eat chicken nuggets and chips. It does help to have less chicken nuggets and chips in the house. There are certain foods that maybe you should not be buying. Something else that really helps is to involve your children in the whole food process. So there is a lot of research that shows that children who eat dinner with their family at the table have less obesity and less mental health problems. So this is quite significant. None of us want our children to be at an unhealthy weight. None of us want our children to suffer more mentally than they need to. There's enough things out there, social stressors causing anxiety, causing depression. If there are things that you can do, you want to do that. And that is something that you can do. Make sure you have family dinners. So I get how difficult it is in North America. I understand this whole thing that's happening with rep sports and 3 children, having them in so many different activities. We had to limit our activities. It's hard. My children prefer to be in as many activities as they can, but we had to make a decision as a family that it's more important to us to have dinner every night together as a family. Our children's mental health and our children's physical health is more important to us at this point than them enjoying a specific sport. And then even if that sport is going to get your kid a scholarship and get your kid into a great university and get your kid a great degree and end up at the best law firm in town, it doesn't help if your child then develops type 2 diabetes at 40 and a heart attack at 50. So it is quite important if we want to give our kids something, it is health, and we can do something. And now that I'm here giving you this talk, my husband went with the kids to the park. Every night after dinner, we go for a walk. These are things that you can do that's free, that can significantly improve your kids' health. Okay, so involve your kids. What we do once a week, we'll plan dinner, and all the kids get to help with the planning. They get to say what they want to eat. Then they know, even if the kid chooses whatever they want to choose, sushi, ribs, they know they have to choose a veggie with that. I take them with me to the grocery store and I say, pick out whichever veggie you want to make. When they come home, I say, today it's Tuesday. We're cooking the meal that you chose. How about you wash the veggies? You help me cook. There's also a lot of research showing that when kids are actively involved in the planning, purchasing, preparing of meals, they're way more likely to eat the food that they've made themselves. What you can do, and you can email us or you can just Google it, the Institute of Functional Medicine has a great resource that you can print on your fridge. It is a color chart where it encourages you to eat the rainbow. So you can every day try to eat something red, like a tomato, something yellow, like a yellow pepper, something green, like some broccoli, something purple, like purple cabbage, maybe wild purple rice. So every day you can check, your kids can check. If you don't have the bandwidth in one day, maybe try to cover all the colors within a week, where you try to eat from all the different foods groups. Kids like it. Something else you want to maybe do is surround yourself with other people that are as passionate about raising healthy kids. So research also show us that we become like the people we surround us with. If your friends come over Saturday night and it's always just chips and pizza takeout, that is what you will do by default over some time. And if their kids drink pop and they give their kids granola bars to school, that is what you will do. If you make a decision to surround yourself with people who do eat more healthy, you will become more healthy. It's just, for example, my sister started this WhatsApp group, and I recommend you start a similar group with your friends where she share mommy meal ideas. So my sister is a high flying executive. She's up high in her job. She travels all the time. She has a rock star job. But still, she prioritized the health of her 5-year-old. So she knows it's important to try to be home for dinner as often as she can, to try to cook as often as she can. But what do we cook? Right? And even if you have this elaborate healthy meal, will your 5-year-old eat it? So she has this WhatsApp group with mommy meal ideas. And then one of the things she shared with us was baked broccoli with baked cauliflower with the most delicious sauce, tahini sauce on top of it. It looked delicious. She shared it to the group. I made it tonight for dinner. I shared it on my Insta. So if you're interested, I shared the recipe on my Insta in my stories. Yeah, it won't be in my Insta for long, but it's tonight on my stories. Great recipe for such a healthy oven cooked cauliflower. So I saw one of the questions in the chat is it okay frozen foods? Your healthiest food with the most antioxidants, phytonutrients, the things that will really help you fight autoimmune disease, decrease inflammation, help with the decrease of chronic pain, would be foods that are freshly picked. So if you have access to things like Mama Earth, where they ship food or deliver food from local farms at your front door, that would be best. That's best case scenario. So that's the way that most nutrients are kept in the food. If it's local produce from a local, and wherever you're watching this, looking at this, you can just Google and look at local initiatives. Find a farmer in your area where you can eat food that is in season, that's locally grown, pesticide free. That would be most nutritious. Then, second best would still be fresh fruit and foods that are maybe shipped in from. At Costco, we get the most beautiful food from all over the world. It's still fresh, it's still good. When people flash freeze food, they do preserve nutrients. And then the more we process food, if we maybe can food, then over time, some of the nutrients will get lost. The more we process it, more nutrients are lost. That being said, it is still healthier to give your child frozen berries to school than a granola bar. And that is things that I would really encourage you tonight. I want you to take away one thing, even if it is just to add one serving of veggies to your meal, to your food every day. Or for your children, when you pack their lunches, change one granola bar with freshly cut up peppers and hummus and carrots. If you just make one small change today, you can be like that big boat on the ocean or your small little kayak, yeah, in Bronte Harbour or in Wellington Beach. If you just make a small change now, just add little bit veggies, cut back on one glass of alcohol every day, just because it disrupts your gut quite significantly and cause leaky gut. Just avoid some toxins in your food. An easy way to see if there are carcinogens in your food or additive preservatives is to scan it with an app. And an app I like to use is the Yuka app, Yuka. You can use the free version. I don't get any money from Yuka. You can look at the Environmental Working Group, ewg.org. Foods that pesticides that maybe got banned in Europe, but or preservatives, things that got banned in Europe and that are still allowed here in North America. Something else that you can do is just focus on whole foods. If there are 20 ingredients on the package, very likely that some of them are harmful. If there is just one ingredient, then you know what you're getting. You're getting corn, right? That's or even if you're eating hummus, if the ingredients are chickpeas, olive oil, garlic, and lemon. If you can read the ingredients, know what it is, then it won't be toxic to your gut. It won't cause leaky gut. It won't cause that inflammation that lets you absorb a lot of toxins from your environment. So that's quite important. These are things that you can do. If you want something that you can do on my website, I have summer salads. You can download that for free. That can be something you can print it out. So the website is www.wellnessmdhealth.com. You can download my summer salad recipes. It's incredibly good salads. I eat it at home. These are foods that will really increase your microbiome, the diversity of the prebiotics, probiotics in your gut. It will make a significant difference to your health. Try it. I would really want to encourage you, do little things, make little changes from today on that will have a significant impact on your health 10 to 15 years from now. I want you to be healthy. I know you can be healthy. All of us can live with optimal health from within. I cheer for you. You can do this with a little bit of effort and planning and knowledge. That's the big thing. Knowledge is key. And thanks for listening. Thanks for your time tonight. I appreciate every second that you've spent with me. And I'll conclude my part and now give it over to questions, Kumkum.
Does anyone have any questions?
I saw in the chat there were questions. Let's go to the chat. And thank you so much for everyone. Yeah, I really appreciated your time. So, thanks for all the resources there. Yes, atopic dermatitis is definitely a gut issue. How do newborns get it? So, your first question is this newborn exclusively breastfed? If your newborn is exclusively breastfed, the incidence of atopic dermatitis would be less than in kids who are formula fed. So that's just science research. If we look at the research, it does show us that that is a protective factor. So kids will have less atopic dermatitis if they are. But fascinating research, especially people with chronic hives, people with chronic sinusitis, chronic immune issues. When people come to me with those issues, I always do food allergy testing, and that's a very interesting topic. People would come to me and say they've gone to the allergist and they test allergic to everything. What do they do? And then it is quite often because your body is sensitive to whatever, milk, gluten, that you're now making this immune reaction. And because of this immune reaction, you have significant histamine release. Because of this histamine release, you're now triggered and your body reacts to everything. So what we generally then do is I recommend for a lot of people, it's hard, it will be tricky. So I recommend you maybe find yourself a health coach. Then you can, if you're outside of Ontario watching this, you can look at the Institute of Functional Medicine, ifm.org. And there are a list of providers with health coaches. And then I often recommend people to go on an elimination diet. This is something that you can do yourself. You don't need to pay anyone. You can do it where you avoid for a full month common allergens. Most common allergens would be gluten, dairy, um, beef, eggs, all the nuts. Avoid that and obviously anything processed, alcohol, avoid that for a month. Then you'll give your gut opportunity to heal. Then you introduce one thing at a time, maybe only dairy. Then when you introduce dairy, you're going to have dairy 3 or 4 times that day and again the next day. And then you wait 3 days before you introduce anything else. Because quite often when people have gut issues, when they have significant bloating, they'll only have it 2 days after they ingested the thing. That's why it's so hard for us to pinpoint what we're sensitive to. And fascinatingly, we are very sensitive. I get people who are immigrants, patients all the time, and they'll say in their country they used to be able to drink milk, no problem. Then they come to Canada and they get bloated with milk, or they start getting acne with milk. Or in their country, they used to be able to eat bread, pasta, no problem. Then they come to North America, and then our wheat is just genetically modified in such a degree that it causes significant bloating, gut symptoms, heartburn, a lot of heartburn from wheat. That's another topic on its own, but that is a way that you can find your sensitivities to stay away from, say, you can just Google what's your most common food sensitivities for people in your area. Avoid those 5. And then when you reintroduce it, one food at a time, and give it 3-4 days before you introduce the next one, and get a proper amount of that food in. So you don't want to eat just one slice of bread. You want to have some cereal for breakfast and bread and pasta, so a lot of wheat so that you can really gauge when you reintroduce. Yes, let's see what not. So there is a question about made good bars. So fascinatingly, is these food products, I use the Yuka app when I shop. So I don't suggest you go into your pantry and scan all your food because you might have to throw out a lot of food. I do suggest that when you go to the grocery store again, and I look silly because I scan all my products as I go, but what I do when I go into the grocery store is I would scan made good products. And some would show green, yes, this is very good. Then the next one from the same company will show orange because there's a product in it. That product might be perfectly healthy and safe considered in North America. That's why they use it. The company has good intentions. But that product might have been found to be causing disease in a different country. So it's maybe banned in France, in Europe, somewhere. So yes, specifically with made good granola bars or food bites, when I've scanned it, when I buy it for my kids, I would see some products are green, you can use it, some are not. Same for all types of foods, even skin products. And we're not even talking about skin products, but there's quite, it's difficult for me to say that company is good or that company is bad, because quite often most companies have very good intentions, but some of their products would be safe and some not. Is celiac disease an autoimmune disorder or a gut disorder? Oh, I'm so sorry for the diagnosis. Celiac disease, yes. So, celiac disease is a gluten intolerance. It is a gut disorder, but it's also autoimmune. So, the reason why we say it's a gut disorder is that's how we diagnose it. We go with a with a colonoscope, with a camera into the gut, take some samples, and we can see, oh, there's inflammation in the gut. But then it is people who has it who will be more likely to have certain joint aches and pains, because all of these things affect your whole body, right? It's never, nothing in our body stands on its own. Nothing, nothing, nothing. Everything is connected. Your mind, your body, your psyche, everything in your body is connected. So it does affect the whole body. And then what other questions do we have? Yeah, so frozen veggies, I eat frozen veggies as well. It is better. It is definitely better if you can get fresh things from a local farm. But if you can't, it is better to have frozen veggies. That is our go-to. Both me and my husband have um, really hardcore jobs where we invest a lot of time and passion and love and energy into our careers. So it does mean that we often can't cook the way we want to. We want to eat together as a family. And that is an easy way to have a quick dinner, a stir fry. When you put in frozen veggies and you put in whatever protein, 15 minutes and the family can have dinner. You can have rice in your rice cooker. So so you do what you can do. If you have access to fresh, great. If you don't have time to cut it up and it's frozen, that's okay. Does abdominal hernias affect things? So, a couple of answers for abdominal hernias. You can get umbilical hernia all the time from being a little kid. I've had, after my pregnancies, my abdominal muscle opened up with 3 pregnancies. And then after the third pregnancy, my stomach nicely went flat, which I'm grateful for. I know for some women it doesn't. But I had a hernia. I actually had some of my bowel protruding through my belly button that I could push back and then come out and push back. It was quite disgusting. So I had surgery to have it fixed. What I had did not affect my gut health at all. My gut was on the inside, and there was just a break in the peritoneum. Some people have hernias, inguinal, femoral hernia. I'm not sure which one you're referring to. It still doesn't affect your diet at all. Some people have a hiatal hernia. What this means is a bit of your stomach pushes up into your esophagus. Now you have acid the whole time pushing through from your stomach into your esophagus. So that causes, and by the way, weight loss is the best thing for that. If you can get surgery to bind it down, great. And then I know in Canada it is tricky to get surgery for that. So then doctors give you antacids. The problem with antacids though is it helps that you don't have acid reflux. Chronic acid reflux is bad. It can cause esophageal cancer. But then if you don't have that acid, then people develop malabsorption of iron, of vitamin B, of all the nutrients. So that's quite harsh for people who has to be on antacids, unfortunately. because all of them develop this malnutrition. And that is something that's quite interesting. I admitted a guy to hospital who's in hospital now. So usually we don't admit people for bacterial overgrowth or not enough acid into their body for to hospital. Usually, as I said, you're on the spectrum where you're still okay. You have symptoms, but you're not going to die. So we don't admit you in hospital. Unfortunately, in our Western medical way, we only treat the 10% of people who's really going to die. And then people where you can significantly improve their quality of life kind of fall through the cracks. But I did admit someone now who's now in the hospital where we are treating him for small intestinal bacterial overgrowth with rifaximin, which is an antibiotic which kills off the bad bacteria. We're giving probiotics to put back good bacteria. And he really couldn't eat, and it's improving his symptoms to such a degree that he can eat again. He lost significant weight. So it can be very bad if you have these bacterial overgrowth things. I hope anyone that listen here. Oh, ventral midline large hernia. Yes. So no, a ventral hernia won't impact. I would recommend you have surgery. First of all, I would recommend losing weight. That is the best way. If you have any abdominal weight, it will push that hernia out. So the first thing for any hernia would be to lose weight, for things to come down. And then second step is to just have surgery, to have it fixed. That's quite an easy fix. It's just the peritoneum. It's not the gut itself that they have to do. It's just the peritoneum. How do you detect malabsorption? Easiest way for me to detect malabsorption would be to test. Is your magnesium low? Is your iron low? That's a very easy way to know that is your vitamin D low and you're taking a vitamin D supplement every day of your life and your vitamin D is low. Then it's easy to know your gut isn't absorbed. But that's an easy test your family doctor can do. If your family doctor did just the basic OHIP test, OHIP doesn't offer for a lot of tests. It just offers some tests, but you can do those tests first. If those are normal, but you still suspect, then we do gut health testing. I do it all the time. When I do extensive GI testing for people, you can test stool, you can test blood. We will look at the whole spectrum of how your body absorbs food. And that's really the key, why we are so successful at this Wellness MD clinic, is we don't guess, we test. So we do extensive testing. Most of this we have to send to the States. It's out of pocket pay because OHIP doesn't cover for it. But it makes such a significant difference in people's life when they do that testing and they're like, oh, I should avoid sesame and celery and alcohol. Most people have to avoid alcohol. And you know that. And if you just implement that in your life, it can be a game changer for you. Yeah. I think our time is up, Kumkum. This was an incredible. Thank you for being such an engaging audience. Thank you for everyone staying till the end. That is quite impressive for everyone staying. Thanks for staying. Thanks for your time. I'm really, really appreciative of your time. I really appreciate it. And thanks for your questions.
Thank you for listening to this episode today by medical doctor Daniela Steyn. Follow us on social media and subscribe to our newsletter at www.wellnessmdhealth.com to stay up to date on educational resources that will take your quality of life to the next level. The content of this podcast is not intended to be a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your healthcare provider. Never disregard medical advice or delay in seeking it because of something you have heard on this podcast. Remember, you are created to thrive.